Hi, my name is Phyllis Amon, and this is Senior News for Today. In the news, a February 19th New York Times article paints a grim picture of the devastating effects of the pandemic on persons having dementia, on their caregivers, and on their families. Familiarity and routine, predictable schedules, and familiar faces are important for a person having dementia, whether they be the person's own family or a caregiver in a nursing home. With a daily routine that has gone out the window, it has a similar effect on the person having dementia. They also seem to cognitively drift further and further away. In nursing homes and for families around the country, decline in persons having dementia are evident in weight loss, loss of functional ability, and decline in cognition. The person with dementia may lose their words or memory and have difficulty understanding the words spoken to them, but they find meaning and reassurance in facial expression and gentle touches. That's gone with COVID. Mask wearing not only hides a person's smile, but almost totally obliterates facial recognition. It can be scary for anyone to see someone approaching them as if they are the masked bandit, but especially for the person who can't understand the reason for it. It can affect the willingness to accept care from this unknown masked stranger. And touching is minimal, except for providing care. And with COVID, most touching is artificial, as glove wearing is the rule of the day. Now locked away in rooms for reasons not understood, feeling they have been kidnapped or they are some kind of captive or a hostage, confined for endless periods of time, isolated from family and loved ones, having families knocking and talking to them, peering through windows, or on a telephone or iPad screen is almost incomprehensible. There have been reports of increased prescriptions of psychotropic drugs in an effort to sedate residents, to quell their anxiety, or the tendency to act out, as is often the description. A practice long frowned upon, predating the virus, and often contraindicated as a black box warning for some prescribed drugs as being dangerous for persons having dementia. The effect, essentially drugging the person into oblivion. The article reports on a September 2020 study out of Japan, published in the Journal of Alzheimer's Disease, found that people with mild Alzheimer's scored higher on depression scales than people with moderate to severe Alzheimer's. They were most likely to be depressed when they understood COVID-19 and could answer questions like, why are you wearing a face mask? The reason for this is that people in the advanced stages of dementia may not have the awareness of being isolated in a room or family visiting, or understand that their routine has changed. The article reports that compared with others in their vulnerable age group, people with dementia are more likely to get COVID-19 and are significantly more likely to die. The Alzheimer's Association states it well. People with dementia may not adequately comprehend, execute, or recall any of the suggested public health measures. Also, it's extremely difficult to remain socially distant when you live in a nursing home, unless you remain in your room, and only in contact with a caregiver when you need assistance with bathing, toileting, or eating. The article reports that 15% of people with dementia reside in nursing homes. The article goes on to quote Dr. Karlowish, who describes that widespread bans on dementia caregivers are akin to taking away a wheelchair from a person with physical disabilities. And that's a brutal metaphor, he said. But all of a sudden, the people who would come there and help their minds function were taken away. Some geriatricians describe this separation as unfortunate and damaging, but necessary. Others believe that we should have allowed for a gentler nursing home quarantine, one that recognizes caregivers as essential parts of the dementia healthcare. Katie Engelhardt, the article's author, spoke with several professionals who weighed in on what's happening to persons having dementia during COVID. Jill Harrison, an executive director of the National Institute on Aging's Impact Collaboratory, describes the idea of locking everyone down, which reflects a broader tendency in dementia care to prioritize physical safety above all else. She described the situation of a person in a nursing home with dementia who liked to dance by his window. One day he fell. Rather than finding a way for him to dance, the nursing home decided not to play music any longer. Dr. Harrison called this surplus safety. It's essentially like, we are going to keep you safe even if it kills your spirit. Dr. Ariel Green, an assistant professor of medicine at Johns Hopkins University, said, "What COVID has laid bare is that in general, for older adults with functional and cognitive impairments, we think it's okay for them to languish in bed without any stimulation for days." She added, "In pediatrics, for example, we understand that this would never be acceptable." Please remember to like and click the buttons below to share this episode. And to continue receiving senior news for today, please click the buttons below to subscribe. Until next time, stay safe, stay well, and stay tuned.